Hi guys, so you got an implant put in and you're wondering whether it should be removed or not. Okay, so let me tell you the reason for putting an implant. So once we put an implant, the implant reduces the stress across the fracture site and helps the fracture to heal. If the fracture doesn't heal, eventually the implant fatigues and breaks. Once the fracture is healed, the purpose of the implant is done and the bone takes the load across the old fracture site and the implant does not take the load anymore, so it being there is pointless. So, does the implant have to be removed in all situations? No, not necessarily. What are some situations where implants may have to be removed? For example, is hardware prominence, as you can see here. Other important thing is if the implant has penetrated into the joint over the course of bone healing, if the implant breaks, if there's an infection, be if the implant is prominent. So there's also a discussion of whether which implants have to be removed. Suppose you used a low grade stainless steel which has less corrosion resistant properties, then the implant may have to be removed. However, if your implant is made of titanium, there's no necessity that the implant has to be removed unless it causes a problem. Also, there's a certain implants called biodegradable implants where once we put them in, there's no need for removal at all. So this is an example of a case where an implant had been put in, and 2 years post-op, the patient wanted it removed. And once we removed it, this is what it looks like. You can see these small lines in the bone, and these are nothing but the places where the old screws used to be there.